Today we're going to talk about setting limits and addressing behaviors. This is something parents struggle with from time to time and something that we can really help you with. We're going to talk about the importance of setting boundaries and placing limits in order to help children feel safe. One of the first things that we can do as parents is to have a plan. To know in advance that, you know what, every night is when my child is falling apart and having a temper tantrum right before bed. Or while I'm getting dinner ready, that's when the kids are fighting. So having a plan ahead of time and saying, there's a pattern here. This is when there is an issue in my home, and what can I do about that? So going into a situation being thoughtful and planful to say, you know what, I'm going to set this up differently. I'm going to give my child a warning before bedtime, and we're going to have a routine in place. Or while I'm getting dinner ready, I'm going to have these toys available, and I'm going to say to my children, here, come and play here while mommy gets dinner ready. But being planful and sticking to that plan will bring about a positive change. Listen to yourself. This is the piece of advice that I give the most frequently. Reflect on what you are saying to your child or your children and how you are saying it. Are you asking a question such as, do you have to go to the bathroom? Instead of saying, it's time to use the bathroom. Are you saying things like, are you ready for bed? Instead of, come on, it's time for bed. Those are subtle differences, but they make a big change in behavior. Make sure that you're not repeating yourself. Come on, it's time for dinner. Come to dinner. Come on, let's go, it's dinner. Say it one time, and then if you have to, encourage a child by taking them by the hand and walking them to the table. Don't repeat yourself or ask questions because you're not being clear with your children when you do that. Nonverbal cues are very powerful. The look on your face, your eyes, your body language can really give a message to children, sometimes more so than words. So pay attention to what your face is saying. Make sure that it is matching what your words are saying. Be sure that when you are speaking to or addressing a child's behavior, you're doing it face to face, down at their level, certainly not from the other room. A lot of times parents will say, well, I'm trying to talk to my children, get them to come to dinner, and I will say, well, where are you when you're doing that? Well, I'm in the kitchen, and they're in the family room, 2 rooms away. Well, it's very hard to communicate effectively with your children if you're not even in the same place as them. Pay attention to where you are when you're talking to your children, what your face and your body language is saying, and make sure you mean what you say and say what you mean. Take a moment when you come to your child to address a behavior that exasperates you, that frustrates you. Take a few minutes of time out for yourself to get your emotions under control before you address your child. Because if you come to them and you are so angry your tone of voice is too strong or too scary, it will only set off a fight or flight response in your child. Being sure that you are emotionally regulated will help your child to regulate their own emotions. Crying when you're sad is appropriate. It's normal and it is to be expected, and it's something that we should allow our children to do and help them to identify those feelings of sadness or frustration or anger. And many times as parents, we are busy trying to tell our children to stop crying instead of helping them to identify those feelings and exhibit them in appropriate ways. So make sure that you're staying calm when your child is upset and help them to identify those feelings, that we're not giving in necessarily to those tears and giving them what they want, but saying, I know you're sad that mommy said no to a cookie before dinner, and it's okay to cry. And then helping them to work through that is better than saying stop feeling that way. There are times a parent will ask me, well, why don't my children who are 1 and 4 play well together? Well, the easy answer to that is developmentally they're in very different places with their play. A 1-year-old doesn't understand sharing and cannot communicate his or her needs and wants through words. So setting children up to play without parental supervision will be met with a lot of grabbing, snatching, and tears. So understanding developmental milestones, understanding expectations will help with managing behaviors and addressing issues that arise. Probably one of the biggest hurdles for parents is to be consistent with your children, to set up an expectation or a house rule such as a bedtime, and then be consistent with that. It's so important that we are confident in our decisions and we stick to them, even with our children who may be the big negotiators. We need to know that we are the adults in the relationship and we're making good decisions for or with our children, and our children can trust that we will be consistent and make healthy decisions for them. My mother used to say, because I said so. Gosh, I hated that. We want to certainly set the limit and then keep our explanations brief. It's bedtime. But why, Mommy, why? You can say, because 8 o'clock is a good bedtime for you and tomorrow we have school. And that's it. We don't need to go lengthy into that and explain it to death, but certainly keep it brief. Explain the why if you need to, but don't find yourself repeating yourself. State it once and then go on from there. If they keep asking, a simple face, a hand up, letting them know this discussion is now over and we're going to move on with what the expectation was. Parenting is a lot of work and it can be exhausting. So when the opportunity arises where you can take the pressure off of yourself and put it on, say, a timer, be sure to do that. When my children would sit down with some electronics to play, we would set an egg timer or the timer on the stove, and after 20 minutes when it would ding, they would hear that and the electronics would be shut off. With some practice and some guidance, that would be the routine, and it would take some of the pressure off of me. Setting limits and addressing behaviors in children means changing your ways, how you are addressing your child, the words that you're using, the manner in which you're using them, the consistency with your decisions. Be sure that you are paying attention to your behaviors, and in turn, making some subtle changes will indeed make changes in your children's behaviors.